Good afternoon, everybody. Welcome to the second series of our winter support webinars, and this one's specifically around self-evaluation. Just to welcome everybody today and say thanks very much for taking the time out of your day and in these unprecedented times. Just a quick review of some of the genre movies and people who would play use. Some interesting ones. I have to say, there's some of these actors and actresses I've never heard of. Noddy Holder, don't know who that is, and some dramatic comedies with Melissa McCartney. Is that the second person to say Melissa McCartney? I'm not sure. So thanks very much for getting involved, and that was just for fun, just to get you used to using the Q&A function. And you'll know from the level 1 webinars that we did a while ago that that's absolutely fundamental how you guys communicate with us today. So please use that as we move through. Next slide, please. So to introduce myself again, if you were involved in the level 1 webinars, which I know a lot of you were, my name is Aidan McCrory. I'm the Senior Improvement Advisor here in the Care Inspectorate, and I have responsibility for leading and developing and delivering the winter preparedness learning system today, and specifically around self-evaluation today. Next slide, please. Just to talk you through some of the housekeeping arrangements, it's the same as the level 1 stuff. For those who are new on these calls today, so the only way we can communicate is through the chat function. So again, just to reiterate that if you hover over your screen, you'll see a question mark inside a speech bubble, and that's how you can put your comments into the chat function along the sidebar. And at the end, we've dedicated quite a bit of time to go through all those questions, because you're going to hear quite a bit of information today around self-evaluation and the process for doing that. We're going to have some guest speakers, which I'll talk about in a little minute. So please use the Q&A function. We're going to have around half an hour, if not longer, at the end to go through all those questions, and anything that we don't answer that we will send out then with the slides that you'll receive also. Also on this slide, you'll see the link to the self-evaluation tool and the guidance documents. The self-evaluation tool went out in our provider update. The links to that went out in our provider update on Friday. So if you haven't had the opportunity to review that tool and the guidance documents, please do. And here is the link again, and we'll reiterate this link before we move on, or before we leave today also. So yeah, that's where you'll find it. Please do go and check that out. Next slide, please. So as you'll be aware, due to the unprecedented nature and situation within COVID, we have developed a tool that's specifically for self-evaluation in the COVID context. But that's not to say that that's where this the functionality of this tool ends. And some of our speakers will get into some more detail around that. But this is designed to support services right now around COVID, but also with a view to the future around all the other elements within our quality frameworks. And also to say it's an important message that we're well aware that organisations and providers have their own self-evaluation processes, self-reflection processes. So this is not to supersede those, and this is not to say that this is the answer to all those issues or concerns that you may well have around those processes, but this is designed to be a really flexible tool that complements your current self-evaluation process. You can cherry pick elements out of this that work for you. There's quick win options that work for you, and you'll hear a bit more of the detail around that when we hear from our speakers. So just to say that this isn't mandatory by any stretch. This isn't part of our scrutiny process just now. This is a tool to support you in the sector to evaluate your own position in the COVID context. Next slide, please. So what do we want to achieve today? What's our aims and objectives? So we want to make sure that we are talking to as many different services as we can at once, so that we're having a really consistent and clear message, so that everybody hears the same thing at the same time as much as practically possible. We also want to explore the background and context about how this tool was developed, and how it builds on previously issued guidance from the current inspectorate around self-evaluation and takes it to that next level with a real roadmap and real detailed description of how to use the tool and self-evaluation generally, and really how it links in with our scrutiny and assurance frameworks, which you'll be familiar with. Key question 7 is obviously around the COVID context, and that's what this tool focuses on, but it has obvious links to other elements within our scrutiny and assurance frameworks as well. We also have some guest speakers today who are going to talk about the tool in practice. We've asked a service manager to come along who's been able to look at the tool in advance and tell us how they would use that within their own setting to try and bring it to life a little bit for you. And then we obviously want to take quite some time to answer any questions around the tool's use and its practicalities. We're also going to hear from an inspector in the current inspectorate about how this tool or how self-evaluation would be viewed from a scrutiny and assurance point of view. And again, just to reiterate, please put any questions that you have in the chat function, because we will come to them either today or after the event in writing when we send out the slides. Next slide, please. And again, just around the context of the support the current inspectorates are delivering around winter preparedness. A lot of people here will have been at the level 1 webinars where we signposted the resources and our COVID compendium and our FAQs that are on our website. This is the level 2 element of that, where we're going to really take a deep dive into self-evaluation around key question 7 in the COVID context. And then after Christmas, after we've gathered as much information as we can from you guys in the sector, all the intelligence that's available to us through grades, through notifications, through the Safety Huddle tool, we're going to take a deep dive into real pinch points that have been identified that are out there within the sector. So thankfully there's light at the end of the tunnel with regards to vaccination, so it may well be issues around that. It could still well be issues around visiting, PPE, IPC practice. We just don't know yet, but once we understand what those real pinch points are, then we'll be designing a series of webinars to really take a deep dive into those specific topic areas to try and support you further with that. So what I'll do now is I'll pass on to Daniel Stoddard, an inspector who was integral in the development of the tool. Next slide, please.
Good afternoon, thank you very much. My name is Daniel Stoddard, as Aidan said, and I am normally an inspector, but for the past couple of years I've been part of the business transformation team. So developing the different versions of the quality frameworks for the range of services that we regulate. Just to introduce the potential for some tension and anticipation into the proceedings. I do have a dog, so if my doorbell goes while I'm speaking over the next few minutes, my dog will go bananas. I will try to quickly mute my mic, and then we'll just wait calmly until order is restored. Next slide, please. Thank you. So my plan is to talk a bit about the background to the self-evaluation tool and describe how we got to this point. And then I'll hand you over to my colleague Sharon Reynolds, who'll do the serious heavy lifting of walking you through the tool itself. The self-evaluation tool was built to fit in with what we've previously said about self-evaluation. We felt it was really important that we didn't completely change tack on that, and it was really important that that providers that you don't feel that you're being asked to do something entirely new. So we've set the scene up to a certain point. We need to continue in that vein. So the self-evaluation tool has been designed to help you use the quality frameworks to evaluate your service or aspects of your service, and it uses the 3 questions within the framework. So how are we doing? How do we know? What we're going to do now? As Aidan has already outlined, the tool is entirely voluntary, so its purpose is to support you to self-evaluate, and we think you should, but it's not compulsory. And neither are we saying that you have to use this particular tool. If you've already got a model or processes for self-evaluation that work for you, you don't need to adopt our one. So it's meant to be supportive. It's meant to help you with self-evaluation if it's useful to you. And we've also designed it so that you can select some parts of it to use and ignore others. You can kind of pick and mix it. It's really about what works for you. Really conscious of the pressure on services at the moment, and I've been to a number of provider forums in the last few weeks, and there's a consistent message of fatigue, of people working really hard to keep their heads above water at the moment. So really important that we recognise that and take account of that. I can't move the slide on. Next slide, please. So just a reminder of how the frameworks are structured in terms of the key questions and the indicators underneath each key question. So if you manage a care home, you'll be really familiar with the quality framework. You will have had at least one inspection using the framework, depending on whether you're a care home for older people or a care home for younger adults. Just a kind of quick recap though. So the frameworks were introduced following the introduction of the Health and Social Care Standards in April 2018, and the Health and Social Care Standards really raised the quality bar. As we know, much greater focus on outcomes for people on their experiences and on people's rights. And so the introduction of the frameworks really caused us in the Care Inspectorate to consider how we should best reflect those significant differences in how we evaluate the quality of services. And I guess alongside that was a move, a strategic kind of decision within the organisation to move away from a more compliance-based model of regulation towards a collaborative and improvement-based model. And those two things then contributed to the development of the quality frameworks. There was an extensive consultation process for the first framework, which was care homes for older people, and around 60 test inspections, feedback from those tests. That all helped shape how the framework looked and how it would be used on inspection. So the Care Homes for Older People framework was introduced in July 2018, and then Care Homes for Adults in, I think it was in May of the following year, 2019. And that consultation process has been a fundamental aspect of every kind of subsequent version of the frameworks that we've developed. So that involvement of people from within the sector has been absolutely essential. The challenge of developing the frameworks was, I suppose, to interpret the health and social care standards for each of the different types of services that we regulate, but also for inspectors. They make us ask different questions. They make us view the evidence that we gather on inspection through a different lens compared to our old approach. So, and we'll hear more about this later, but the questions we ask ourselves on inspection now are much more about what's the impact on people. It's much less focus on inputs and processes, and much more focus now on the impact of those processes on people's outcomes. When we reviewed the frameworks last year, and the publication of that review was held back because of COVID, like so many other things. But the review that we carried out told us that providers felt the frameworks were really easy to use, that they help people to understand the Care Inspectorate's expectations. So that's really important in terms of procedural justice there. And also that the framework supported a focus on people's experiences of their care and support on outcomes, and that emphasis helped providers then improve outcomes for people. Providers were also they gave us really positive feedback about how the frameworks might support them with improvement and with their own self-evaluation. So really positive, overwhelmingly positive feedback about the introduction of the frameworks. We feel that the sector has kind of embraced the introduction of the frameworks, been really keen to engage with us in all of the consultations that we've done, but also given us feedback about them. Next slide, please. Okay, so just a reminder of how the different elements of the framework all kind of fit together. So we've got the key question, and then beneath each key question, there's a number of quality indicators. The quality indicators are broken down by key area, and there's a series of quality illustrations which act as kind of signposts to help inspectors evaluate the quality of the service. So it gives inspectors a structure, gives a more consistent means of evaluating the evidence that they see, but it also it helps managers of services view themselves through the lens of those illustrations, so you can measure yourself against those illustrations. And from the outset, we have spoken about the frameworks being a tool for self-evaluation based around those three questions. How are we doing? How do we know? What are we going to do next? And when we set out the quality that we expect services to be able to achieve in those illustrations, we're setting a benchmark against which you can measure your service. And that's why it's been so important to have the involvement of providers in developing the frameworks, to make sure that those illustrations actually reflect a level of quality that is attainable, that is raising the bar, that is stretching services, but is realistic. Getting that balance right is a challenge. Next slide, please. You'll get weary of hearing that phrase. So how have we suggested using the frameworks as a self-evaluation tool? So in this left-hand column, we've got our scrutiny actions. So these tell you what we'll do when we come to inspect a service. So inevitably that involves observations of interactions between staff and people using that service, and we always talk to people who are using the service. And one of the kind of core bits of feedback that we get from inspectors about the introduction of the frameworks is how that has enabled people to spend much more time actually observing the care and support that takes place, rather than being trapped in a room with lots of folders, which is nobody's idea of fun. So these scrutiny actions are what we will do when we come to inspect. You can do them too. The scrutiny actions are the way of gathering the evidence and then measuring that evidence against the illustrations. When we find areas for improvement, or you find areas that you want to improve, you can use those improvement resources over on the right-hand column to get ideas to look at how you can generate that improvement. Okay, next slide, please. So, key question 7. The key question 7 was developed at pace and added to our quality frameworks, obviously as a result of the pandemic, and our need, first of all, to have a methodology for inspecting services during COVID, but also to support you with evaluating your own service during COVID. What we've tried to do with the self-evaluation tool is to provide more support to help you with those. We want you to focus on key question 7 at the moment while we're living with the pandemic. Once the pandemic's behind us, we can turn our attention to the wider aspects of the rest of the framework in terms of self-evaluation. But right now, pandemic's everyone's priority, so that's where the priority is in terms of the self-evaluation tool. When we're beyond the pandemic, you can apply those lessons and that approach. You can apply that to the rest of the framework. Right now, key question 7. Just to reiterate, it's meant to be helpful and supportive rather than an additional burden. If you've already got good self-evaluation in place, you maybe don't need this. You certainly don't want to ditch what you've already got in favour of this. So pick and mix, get the best use of it for your service. I guess just to reiterate again, really conscious of the pressure on services. So we want to. This is a supportive tool rather than an additional burden which you can do without. Okay, thank you. I think that's the end of me, and I will hand you over to Sharon.
Thanks, Daniel. So I'm Sharon Reynolds, and like Daniel, I'm also one of the adult inspectors that's been seconded over to our business transformation team for the last couple of years, developing the frameworks. So a bit of a mix there. So I'm just going to talk to you a little bit about the actual process of the self-evaluation and some of the tools that we've published for you. So first slide, please. Okay. So it may seem really obvious, very self-explanatory, but read the guidance. Good starting point. The guidance that we've given also signposts you to additional guidance that already exists. So things around the model for improvement, the various quality frameworks, and also our previous guide to self-evaluation that was published last year. And that does break down a bit more details around some of the things that we're going to talk to you about as well. So having read the guidance will help you understand the process that we're talking about, the entire process, and also give you an idea of maybe what you're already doing that works and would fit in with the process. We want the process to be effective for you, so some things you may need to tweak slightly or just improve upon to get the best possible outcomes for it. But by reading that guidance first, you'll get an idea of the effective process that we want to help you with. So obviously that will also help you consider maybe your own quality assurance processes that you have in place that you may just need to tweak, or that you may already be doing, as Daniel says, this stuff already, and we're not asking you to necessarily replace those processes, but maybe there's something we can offer to enhance them. Next slide, please. So the process itself, the process of self-evaluation is based around 3 what we call self-evaluation questions. So how are we doing, how do we know, and what are we going to do now? So the how are we doing, this is the key to knowing whether you're doing the right things in the right way, and whether as a result of that people are experiencing high quality, safe and compassionate care. So the scale that we're using there is based on our own grading or evaluation process, and we've got really clear guidance about that within the frameworks about what are the expectations under each of those evaluations. The how do we know? So that's talking about how have you arrived at your evaluation of question 1. This is about using evaluative statements based on evidence that you've collated. Question 3, what we're going to do now. So that's about understanding how well your service is performing, helping you to see what's working well and what needs to be improved. And from that, it should lead nicely into you being able to develop and prioritise your plans for improvement. So these self-evaluation questions aren't new. They are in our guide to self-evaluation that was published last year that I just mentioned, that's signposted to in the guidance for this self-evaluation. They're also part of our quality frameworks, and for support services and some of the children's services, they were actually incorporated into a version of the frameworks a while back. So they appeared after each of the quality indicators to help people use the actual quality indicators and the framework together in that self-evaluation context. So they're not new, they're nothing that we kind of introduced just specifically for this purpose. So these questions form the basis for the self-evaluation tool that we use. And you can see on this slide an example of one of the key areas from the self-evaluation template that we've used. So for each key area, you're going to complete each of the 3 questions, and that's going to lead you to identify what's working well and where there's going to be areas for improvement. So next slide, please. So question 1 is about getting feedback from people. It's about the evaluation of your service, the how are we doing bit. And this decision, the evaluation, it needs to be made in collaboration with a variety of people, people who are using your service, people who are visiting your service, your staff, and that includes all roles and levels of staff. Your domiciliary staff, your support staff, people who are maybe working in the kitchen. It's about getting everybody involved because everybody's got something to offer you in terms of feedback. So that can be done in a variety of ways. And whilst for this particular toolkit, we've produced some example questionnaires for you, we're also really aware that a lot of people have what we call questionnaire fatigue and are kind of sick of questionnaires, but they're not the only ways in which you can gather your feedback. There's lots of different ways, and it's as vast as your imagination will allow, really. So, talking to people, service events, various meetings that you might have. Obviously, all of these things are kind of a little bit difficult right now in terms of the COVID context. So it might be that talking to people and meeting people is done via either virtual methods, over the phone. There's going to be different ways that you're actually getting that feedback right now. So what you need to do when you're thinking about your feedback is to consider the information you want to get from people, as this is going to influence the actual questions that you ask them. The example questionnaires in our toolkit, they're just that, they're examples. For your service, you need to consider what is important and tailor those questions so that you can gain the feedback that you need for your particular service. You might know already where there's some issues in your service. You might be thinking there's some issues around a certain area because maybe you've had a complaint or somebody's made a comment. Using this, you can tailor it very specifically, and you can break down the key areas. So whilst we've used the key areas of Key Question 7 for the actual tool itself, when you're getting your feedback, you can break those areas down. You can be more specific in your feedback because all these little things contribute to the greater area. And you can see that by the quality illustrations that we use under each of those key areas. So an example that we've got in here is around infection prevention and control. So the wider key area is about people being supported to stay safe because there's good practices in place. However, one of the things that might contribute to that is that people are seeing that staff are around cleaning and that they feel that their personal space and the areas that they use are clean. So you can tailor that really specifically to what information you want to get. It's entirely up to you. Like I say, that what we've given you are examples, ways in which you could possibly do it to give you an idea. So again, have a think about what it is you want to know, and also what are the best practice guides saying, what are the standards saying. Have a look at good practice information. So we've got lots and lots of information coming at us at the moment through Health Protection Scotland, Scottish Government, and there's lots of things signposted to in the frameworks themselves and under Key Question 7 and the quality illustrations. So all these things combined will make sure that you're asking the right questions. So by asking people to evaluate the key area using a scale, that enables you to actually measure your performance in a more systematic way. It also means that you can repeat questions later. So if you've asked this question we've got up on the slide now about people's bedrooms and seeing cleaning, if people come back and say to you, well, I think that's only adequate. If you've got lots of people telling you the same thing, that it's maybe adequate, you can put in a plan of action around that. You can also use the same question a few weeks down the line, a month down the line, whenever you feel appropriate amount of time has passed for you to implement a change, and see whether it's made a difference. So when you ask this question again, you might come back and people are saying, well, actually, it's really good now, it's very good, or even good. You'll be able to see that difference. You'll be able to measure that an improvement has actually happened. So the use of the scale is really important. Again, it doesn't have to be that scale in that questionnaire. You can use various different methods, you know, consider your communication and who's your audience. So we've got there some easy board maker symbols as well. So it's about tailoring that communication to suit who you're asking the questions to. It might be that if it's within a focus group, you can get people to hold up cards to say whether they think something's very good or good. There's lots of different ways, and again, it's as much as your imagination will allow you to innovate in different ways of getting that feedback. Another thing to think of is the independent facilitation. So where you're using groups of people or asking specific questions of people, are you going to get an honest answer if it's a member of staff that's doing that? If it's somebody that maybe people don't want to upset or offend by giving an honest answer. Again, more difficult at the moment with COVID, but it's something to consider. And even if that's just a matter of how many different people are asking. So if you've got a focus group and you've got 5 staff in it, do you need all those staff, or is that just happened because that's who was around at that point? If you have less staff in it, people might feel more able to open up and have a different discussion. So next slide, please. So our next question is, how do we know? So once you've got an idea of where your service is actually performing, you need to consider how you got there. How did you get to that answer? This will be a combination of things, including the feedback that you've got from various people and other quality assurance activities, such as your audits, observations of practice, that kind of thing. So your quality assurance processes that you already have in your service should help you to identify areas for improvement, as well as areas that are working well. That information then can feed into your self-evaluation as evidence for your assessments of where you're at. So, for example, if you are looking at maybe PPE, want to consider how staff are using PPE. So you have maybe asked people in your questionnaire or asked people at a focus group, you know, do you see staff wearing it? Is it accessible? You know, are there directions for where you can wash your hands? Those kind of things. So you maybe got that feedback from people. So that's one element of it. But also you might be auditing that. You might be watching staff, seeing if they're using PPE correctly when they should, checking audits of your stock to make sure there's enough stock ready and waiting for staff so you're not going to run out. So there's different elements that will all contribute to that evaluation of where you're actually at. One of the things we say is remember to answer this part of the question using evaluative statements based on the evidence you've gathered. So you need to be able to pull that information together. So it's no point just saying, well, we got a list of bullet points, we got this, this and this, so therefore we know where we're at. How does that help you know where you're at? Evaluate what you're bringing to the question. Also remember, again, you have got some benchmarks there in terms of your quality illustrations. They're going to tell you what the standard is, what's the required standard through either legislation or good practice documents, or like I say, the quality illustrations themselves. there's various bits of information that can give you an idea of where you should be at. The information you've then collected will tell you where you're actually at. And then it's up to you to look at, well, what's the difference between those two things? And that will help you answer then the question about where you go next with this. So Daniel was talking earlier about the scrutiny actions and the improvement resources that we have in the framework as well under each of the key questions. Really good at signposting you to where you can find those good practice documents, where you can find the most up-to-date information, and also good ideas about how you can get there. One of the other things to mention there is in our general framework, key question 2, how good is our leadership? That talks a lot more about quality assurance with examples of what good and weak practice may actually look like. So when you're thinking about how good are your quality assurance mechanisms, that might give you a little bit more structure and something to think about when looking at those as well. So next slide. So we've identified where we're at and how we came to that evaluation of where we're at, and now we need to know what's going to happen next. So by answering all of those questions, you've identified what your service is doing well and where improvements need to be made. So this bit's actually the really easy bit because you've done the work, you've pulled it all together. Now you just need to write your improvement plan. So planning for that improvement, you'll be able to see where the key areas for improvement are because you know what the standard is. You've looked at those benchmarking documents, you've looked at what's good practice, and you know what you're doing, and you know if there's a gap between the two of those things. So there's different ways in which you can come to your improvement plan. You can do that straight off because you maybe have improvements that are already acknowledged within your service that you need to do. So that might come from various other areas or other quality assurance inputs you've had. You can work with staff and with people that use your service to agree on priority areas. What's most important to fix first. Some of those things might be really obvious, but other things won't be. What's really important about completing your improvement plan is that you have really clear, detailed actions in there. So you need to be specific so that people know what it is that's happening. What is it you're trying to achieve? And also who's responsible for that? And when do you want that done by? And it's not so important if those timescales aren't met, because it just gives you a guide about when are we going to come back and review this. And if it hasn't happened, that might be okay because there was other things that maybe came and took priority over that. And you'll see that the last kind of column there, that's for kind of identifying, well, what was the problem? Was there a barrier to us completing something? Did something else happen and that had to take a back seat? And if it did, that's okay. But actually we want to know that, and you need to be able to record that so you can accurately see where you're at with something. Remember, your improvement plan should always be accessible to people. So you should be able to share that with families, with residents, with people that use your service. So people that want to know about where you're at and where the service is going. Where you can obviously include people in doing the improvement plan, that's even better. And we have an inspector that will speak later, but obviously, you know, you're able to share this improvement plan with inspectors if you choose to, and it's great because we always look for an improvement plan. However, doing it our way that we're telling you now isn't the mandatory part. You don't have to do it this way. As long as you have that information, that's great. Obviously, once you've done your action plan and you've achieved your goals, the tool can be repeated to see if those gradings have actually moved, if those evaluations have improved and you actually have done what you think you've done, because sometimes that takes a little bit of time for the impact of those changes to actually come through. So next slide. So this talks a little bit about the barriers, and it was mentioned earlier about appreciating that obviously we're in the middle of a pandemic, you know, people are really pushed for time, and we appreciate that completely. But there are still ways that you can achieve this without undertaking the entire process. There's parts of this that you can do. There's in terms of the improvement planning bit, that's probably the easiest to do. And often you will have those improvements already in mind. So it might be that you have requirements or areas for improvement that have already been made on your service. They're a great starting point because they're already there for you. So you can look at actually setting up improvement plans for addressing some of those as a starting point. The important thing here is start the journey, start making some of those small changes. If you haven't got time to do a big questionnaire that goes out to everybody, okay, grab some people as you see them during your normal daily work. You know, you're always going to be seeing people that use your services. You can talk to them, ask them for a bit of feedback, do what you can, but just try and start engaging with the process and seeing how it can add value to your service and to what you're doing. And these are kind of temporary options that we've offered to you in the guidance as well about some of the ways that you can overcome barriers, but it is about just making that step forward and starting. So our final slide, the toolkit itself. So this is just an overview of the actual package that we've put together for you. So that includes the actual guidance document itself, as well as the tool. We have templates for various questionnaires, so for people that use service, relatives. We have a worked example, so you can see how to answer the questions. And we also have a improvement plan template. These are all available on the website. The tools are in Word format, so they can be copied and they can be adjusted, and you can write into them much easier. The guide itself, and I think the worked example as well, are in a PDF, so you can't amend those bits, but the rest of it you can amend and use as you wish. And I think that is it. So I will now hand you over to Daniel Jenks, who is going to give us a provider's perspective on this. Thank you.
Just unmute your mic there, Daniel.
Sorry. Daniel Jenks, manager at Lornbank Care Centre. First slide, please. So Lornbank, situated in Hamilton, fall under South Lanarkshire Council. We're designed to care for up to 74 individuals. Fall under NHS Lanarkshire. Next slide. So I took up post early 2020, pre-COVID. During 2019, the care home had high scrutiny activity from Care Inspectorate and local authority. Currently, we adopt a 12-weekly quality assurance process. This allows external management and myself with staff team and residents to work together completing a suite of audits. This looks at care planning, medication, catering, maintenance, general environment, but also infection control. Once these are complete, staff are identified for different areas, so we usually try and get somebody who's interested in an area. Once that area is complete, they would then work on the action plan to establish where a theme is identified. So we look at free care plans and the same concern, same thing that needs improvement is identified. We would include all care plans, recognise this. And for the next 12 weeks, sorry, we would work towards the action plan to rectify. Next slide, please. So as it was previously says, the quality framework's been out since 2019, with self-evaluation for Key Question 7 being introduced 2020. It's designed as a self-evaluation framework, allowing services to look at quality framework and interpret where they feel that they're doing well and may require improvement. The tool just benefited us here because it allows you to look at best practice, the quality indicators, and it's also been welcomed by staff because they see it as a benefit as to where they are and where they can go. And it's also user friendly. The 3 main questions in the tool is: how are we doing? How do we know where we are? And what are we going to do now? Next slide. So the example we looked at was Lornbank had remained COVID clear from March until October, with an outbreak being declared at the end of October. Following this outbreak being declared, we found that previously positive relatives, this could become quite negative. The staff team struggled with feelings of guilt and failure. So we'd used internal quality assurance. We'd worked in partnership with Infection Prevention Control, Care Home Liaison, and they'd come in and done visits in the home. This was looking at the environment, staff processes to do with infection control, but the staff were still left with these negative feelings, the feelings that something had gone wrong, we'd maybe caused the outbreak. So the tool itself would have helped us reinforce our own internal quality assurance and using best practice such as the staff observation, our own policies and procedures, and just pulling everything together along with our own process. The other good thing with the tool is, as it was said before, you don't need to use the full tool together. So at the height of an outbreak, 7.1, 7.3, not necessarily that as important as 7.2. So you're able to look at infection prevention and control, look and see where you're at, what may need changed, and that feeling to boost staff, to offer staff reassurance. So one of the big things that came out from our own internal processes was that staff felt guilty, and hand hygiene came up a lot. We've done a lot of staff observation. Staff were doing, there was no major concerns identified, but they still had these feelings. Next slide. So through that process, which we would have been able to capture by using the tool, was brainstorming with the staff. How do we reassure staff that they're not doing anything wrong? So we came up with the Gutterbug idea, purchased the equipment that we needed. We worked with the staff, this is one of the staff's hands after it, and just working together, doing it in small groups as well, keeping physical distancing, but just rather than hitting the staff with another policy, another procedure, making it a bit fun for them. And we still do this just now. If we notice that staff morale's down, even though staff aren't as concerned with their hand hygiene, we still use this to just for the staff to get together in small groups and spend time together. It's a bit of a laugh and a joke as well, and it just puts a bit of fun in it. Once we're just coming out of the outbreak just now, so we would then look to move on to revisit 7.2, infection prevention control, make sure we're doing everything that we can still be doing, but then be able to break into the other sections of the tool and allow us to see where we're at with that. Next slide. So reflecting on the tool itself, it reinforces our own internal quality assurance. It lets us evaluate the service, lets us identify areas where we might not be doing so good, areas that we are doing good, which in turn would boost staff confidence, recognising that especially during an outbreak and those feelings of guilt are there. We worked a lot with psychological services, the local mental health team, local authority and the health board, who provided a lot of support, but I found the staff get more from each other as well. So the support has been absolutely excellent. But behind adding things such as the hand hygiene, the glitter bug, recognising when I was low, it did find a fun way. And recognising that. And with the tool being developed the way it is, you don't need to use it all. You can use different sections, different parts, and you can break it down as we did, and that really did benefit the service. And again, it's not only for service development, but for reassurance as a manager, reassurance for myself, but also the staff team. And I'll hand over to Alison Iles, Inspector for the Care Inspectorate.
Just unmute there, Alison.
Wonders of technology. Hi, I'm Alison Iles. I'm Inspector for Care Inspectorate and I'm based in the Lanarkshire areas. So unfortunately Daniel has to deal with me, who's just been on previous. I was asked to kind of speak in terms of in relation to an inspector's view in terms of quality assurance. Next slide, please. And really, it was self-evaluation's not new. If a lot of your managers will be around for a long time, as have I, and we've always been looking at things like self-assessment, self-evaluation, and engagement with people. Clearly, as an organisation, we see that self-evaluation is a strength in terms of leadership and management. And there's an expectation that through self-evaluation that people are able to deliver positive outcomes for people who are experiencing care in their care services. You'll all be aware that normally we consider your quality assurance and improvements through the quality indicator 2.2, which is your quality assurance and improvement is well led. And I think what we look at and what the quality illustrations will show is that what we're looking for is how do you do that through your inspection processes, and that is, as other people have highlighted, looking at areas such as your quality assurance system, your own self-evaluation, how you seek to engage with others in getting feedback, as Sharon showed within her slides as well, in regard to your service users, family, staff and external stakeholders, and how you actually seek their views and take them forward as well. I think what we would say is self-evaluation is positive. That's how we see it. If you find, people shouldn't be discouraged to find that they've got areas that they think they can improve upon. And I think sometimes in the past people have thought if I identify that, that's a kind of mark against us. But actually, as inspectors, if you've done a really good self-evaluation and through your own processes, as I say, taking on feedback, your own quality assurance action planning from meetings or any questionnaires done, and you're able to demonstrate to us that you're taking these forward, then that's a positive and in your favour. When it comes to the inspection process and us looking at and some of us will ask, I think, and you'll be aware in the past couple of years we've asked for your improvement stroke development plans as part of that inspection process. And where you're identifying actions, the hope is if you've completed that well, that actually when it comes to feedback from the inspection process, there should be no surprises in there.
because your own evaluation has been effective enough that you're identifying where you want the areas you feel you need to improve on. And basically what we're doing is we're confirming that and we're agreeing with your evaluation. That also helps in terms of grading or in terms of making areas for improvement or requirements, or more particular areas for improvement, because if you're already identifying that you need to improve, say for example in medication recording, then we'll identify that you've actually identified that yourself and not maybe put a requirement or area for improvement on that because you've worked and you've identified that yourself. We've seen lots of different processes in terms of, as people have said previously, you don't need to use this tool. I think it's helpful to have, because I think in the past some services have struggled with self-assessment or self-evaluation. Sorry, Aidan. I've struggled with that, particularly when you're standalone services and kind of how to move forward and how to identify issues. So I think the tool there that's now been made available to you will help some services to actually work through these areas and to identify probably more in-depth action plans and clearly identify what actions they want to take. I think the key bit as well is sometimes we go to services and improvement agenda or improvement plan managers seem to hold on to. Where we find more success in taking forward and seeing improvements in services is actually where that is shared out amongst other staff. People have talked previously about staff who might have an interest in infection control, continence, and I know some services have, for example, champions in these areas. And actually, what I've seen in inspection is where staff are encouraged to lead and take responsibility for following through on an improvement. It assists with their morale. They take much more ownership on what's happening within the service, and therefore improvements, I think, are more deep set within the service. And it also means, as we always say, if the manager went off, how does improvement continue? And that's by having that action plan shared out amongst people. It could also be with some of your service users in some of the areas, and to ensure that that process of improvement continues. In the end, it's all about being able to show that you've identified areas for improvement, and I think it's that bit about prioritising. There is you may find that there's a number of areas you want to improve on, but it's about being able to prioritise and say what do we want to lead on first, and then what's our priorities, and then work down. So some people have kind of traffic light systems with the red, amber, green things, so that the key ones that they feel they need to make improvements as a priority, that's where the energy and effort goes initially. But it is, I think, as Sharon highlighted, it's about ensuring that if you've set timescales and you've set actions that you haven't been able to meet, please just go and update it, review it. Things like COVID have come, and where people have had improvement plans probably up till March time, a lot of that will be put in, or most of it will be put in the back burner. So just evidence where you're going, what you're doing, because that shows us that you are continually looking at that. I call it a live tool. So your self-evaluation should always remain live, that you'll add to it, you'll take stuff off when you've when you've assessed that you've actually reached that improvement, but that you will continue to get feedback, you will continue with your audit processes, you'll have complaints coming in that might have actions required, and that all that should be continually feeding in to your self-evaluation and ensuring that there's still this continual process of development and improvement within your service. And the format with the tool, I think, helps just put that improvement planning into perspective and lets you have a working tool that is easy to share with others, including the people that are living in your services, so that they're aware of what's been worked on and where you are with regard to actions. There's nothing worse than going in somewhere and seeing, for example, audits repeated on a monthly or 2 monthly period, but the actions aren't moving anywhere. And as an inspector, that leads to us being concerned about the kind of leadership and that ability to improve. And obviously through the standards, you're all aware that we do have a key questions 6 that we haven't actually kind of worked on, but that's about that overall capacity for improvement for a service. And I say hopefully, whether it's this tool or using some of the learning that's coming out from this tool, will help yourselves in order to move forward and not for everyone, but for some people help move that improvement agenda and self-evaluation forward. The last thing I was going to share with people, that there's been some work from the themes from the COVID inspection, and I just thought it was helpful maybe to share with yourselves, and it might help in terms of looking at areas where you might want to work on self-evaluation just now. And this has been pulled together from the inspections that have been carried out so far. So next slide, please. So these are, there are, is that 2, 4, 6, 8, there's 12 areas that have been identified from inspection. They fit in to, and you'll see a lot of them will actually fit into particularly 7.2, but there's other areas that will fit into 7.1 and 3. But if you're that bit about talking about cherry picking elements that you might want to look at and make sure are developed and are as appropriate as they can be. Just now, you'll see them there. So we've got stuff like laundry management, the housekeeping, and we've got lots of services that are continually having to do things like, through evaluation or through audits, are finding there's bits missing, and how do we strengthen up the audit and the tools we're currently using. Big emphasis, as we've already talked about, on infection prevention and control practice, the use of PPE, staff uniforms, social distancing, travel and breaks, because we're aware in terms of staff travelling together and the increase on infection caused by that. How do we continue to make sure that people keep in touch with those important to them? And about the supporting people to social distance, and we know that can be difficult in services, particularly when you set your lounge out and come back in the next day and you've found you've a couple of service users who've rearranged it for you again. Next slide, please. And these are the other ones. So supporting people in rooms, again, that's quite a big one, about how you can evidence that you're providing support to people who are isolating or people who have chosen to isolate, which we have. Your staff contingency plans, about your use of staff cohorting, agency staff, and the management and quality assurance and oversight. So these are the kind of 12 key themes that have come out from the inspections that have been undertaken so far. And as I say, I just thought it might be helpful to share them with you as areas that you might, if you've not been inspected, that you might want to have or want to improve on where you were, as areas that you might want to concentrate on and use the self-evaluation tool to assist you with that. I think I'm now going to pass it on to a Q&A session.
Thanks, Alison. That was very helpful. So I'd just like to ask people on the call if they have any questions about anything that we've kind of discussed today and communicated with you today. Please pop them in the Q&A section just now. There's been a couple of questions there that I think Lisa's going to take and field to our speakers, and while she's doing that, if you could have a think about anything, and you can do this anonymously as well in the Q&A function. Any questions you might have around the application of the tool, how to think about what areas that you might want to focus on, how maybe the observations and the questionnaires might work together, any practicalities around that. I mean, from a service manager point of view, you know, would you want to do that anonymously so that you get you know, real honest feedback from the people who work within your service? And when we talk about people who work within the service, it's not just people who are providing care, it's right down to caterers, domestic staff, visiting professionals. All these people have real insights into what happens in the front line within services. And we quite often find, certainly through my practice, that those are the insights that are most valuable, because in some instances, managers can make assumptions about how the process works. But in reality, instead of going from step 1 to 10, people go from step 1 to 4 to 3 to 6 to 7 to 9 and then 10. And when you're designing solutions and interventions to that, it's really helpful to have those insights. So I'll pass over to Lisa, who will field the questions.
Great, thanks, Aidan. So we have a question here from Alex that I think might be suitable for Daniel Jenks to answer from his point of view, or for any of the inspectors. And the question is, do many providers use online self-assessment or online systems, so the templates are updated online and can be shared easily, etc.? Would anybody like to take that question?
I think, sorry, it's Daniel Jenks.
Great.
The way that we use our process is it's an Excel spreadsheet, so it stays live, it's printed for the staff team to be able to have access to it after each update or while we're working on it. In terms of online processes, all our care planning system is all online, but sticking with the quality assurance side rather than a Word document. So each update that we do shows progress or shows that you're not progressing, and then we can share that with anybody.
Fantastic, thanks, Daniel. Would Sharon, Daniel or Alison like to answer it on behalf of the sector? Anything that you've seen?
It's Alison Isles here. I think I haven't seen any online systems in use. I have seen, like Daniel said, spreadsheets that are used and are live and can be updated, etc. But no, I've not seen anything in terms of self-assessment online in any of the services that I've been in.
Okay, and I think probably the more that it becomes familiar to people and the more that people get used to it, hopefully in time there will be online systems as well in the future. That'd be good. We also have a question from Alison here saying, will you be looking for self-evaluation in your inspections? So that might be a good question for Daniel or Sharon, who's been involved in the development of the tool.
Okay, thanks for that. In the short term, we're not looking for self-evaluation per se. We do ask for, I think as Alison said, we do ask for the improvement plan, which is the kind of end product of the self-evaluation process, but not looking for self-evaluations. We may do in the future, but right now we're not. Early learning and childcare services, however, we have been asking for self-evaluation, and that's been part of our I suppose plans for looking at you know, whether or not to inspect some of those early learning and childcare services. That's been determined through a number of different kind of measurements of risk and concern, but self-evaluation has contributed to that. So there's no plans at the moment in adult services to move to that kind of approach, but we do see the value in self-evaluation, and it may become part of our kind of scrutiny and assurance processes further down the line, but right now it's not.
That's great, thanks Daniel. Alison also made a great comment earlier as well about hoping to see colour mapping with the health and social care standards, and Daniel, I believe you put in a reply to that that's been discussed previously, is that correct?
yeah, those of us who really like color-coded stuff and things to be organised in that kind of way, yeah, we've heard that from a number of different places, that it would be really great for direct mapping to the health and social care standards. And the color-coding thing has definitely come up before. I suppose we have talked about it. We've decided not to at the moment, and I suppose the frameworks all incorporate, you know, they come from the health and social care standards, and we have internally, when we were developing the frameworks, particularly with the care homes for older people one, we did a mapping exercise to make sure that everything in the standards was reflected in the frameworks and you know, had an origin. But we have decided you know, currently not to make that kind of an explicit link. But happy to kind of share internally that that, you know, there's still a desire to see that happen. So yeah, I don't know if the, you know, what the decision will be, but that's where we are at the moment.
Fantastic. Yeah, that's really good feedback to give back, isn't it? Especially for visual learners. It's such an easy change to make as well. Well, not for our comms team, but you know what I mean. And another question from Alison here saying, should we be sharing these, I take it you mean the self-evaluations, with our inspectors on completion? Would Daniel or Sharon like to answer that one?
Hi. So in short, no, you don't need to. The self-evaluations are for you. They're for you to have an idea of what's going well and where you need to improve. So primarily that's about your learning. You don't need to share at the moment these with us. Again, like Daniel said, in early learning and childcare, that's slightly different at the moment, because actually inspectors are requesting that services complete a self-evaluation and then share it with them. That's their process right now in terms of kind of prioritising their scrutiny input. We in adult services do not have that right now, and we are not asking you to share them at the moment, specifically around Key Question 7 and in the middle of this pandemic. We wanted you to be able to have something that can support you identify the issues that you need to be addressing within your service. You know, inspections and scrutiny input has not been happen how it would normally. So there needs to be something that still supports improvement and ongoing improvement in services, particularly where there's so much new stuff that's come in. You know, there's lots of information around infection prevention and control that actually people weren't looking at necessarily before, or certainly not in the depth that they are now. So there's actions for people to take. So this is about being supportive and enabling services and managers of services to actually, you know, take a little bit of control over what they're doing in their service and their own identification of things. The improvement plans, like Alison said, we always look to an improvement plan, whether it comes from this particular self-evaluation, whether it comes from your other quality assurance activities. We will look for that, but we won't look for it to be, you know, branded Care Inspectorate. You know, you can do that how you wish.
Fantastic. Thanks, Sharon. Yeah, I'm going to post a link to the actual page on the Care Inspectorate site for you all in the chat box, with a link to the tool and the various documents. Apologies, because the link that I've sent it to is straight to the document rather than the web page, so I'll put that in a bit. Yeah, and Alison's saying it would really help staff or visual learners to do with the framework as well. So I think that's all the questions that we have just now. Let me just double check.
Lisa, can I pose a question that I know the answer to, but others may not? In terms of how we're inspecting just now, obviously in the current situation, there's lots of virtual inspections being undertaken. I suppose it's for Alison and whoever else is interested in commenting. Would that be a useful tool for inspectors at a virtual inspection as well as self-evaluation?
No, it's Alison here. I mean, as people were using virtual as a way of doing inspections as well. I've only tried it once myself, but in some ways, yes, it was a good way in terms of if people wanted to share where they were. Now, whether that's as a self-assessment, a self-evaluation, or if it's through the improvement plan, but it's about, yes, to share where you think you are, but also where you've identified areas for improvement within carrying out your self-assessment, self-evaluation. And I told you I'd do that, Aidan. Where you've identified issues for improvement, it's good to share them, because it is that bit, as I said, the fact you've recognised where you need to improve, and we are not the ones that are coming in and saying you need to do X, Y, and Z. That's a positive in terms of inspection, and can impact on in terms of grading, because you're recognising these issues yourself. So yes, it is good to to share that level of information in whatever format you wish. If you were having a virtual inspection.
Great, thanks. All is forgiven, Alison, don't worry about it. Thank you. And I suppose it was, and we have kind of touched on this slightly, and we have said that, this self-evaluation tool is specifically designed now around key question 7, but you will be familiar with all the other key questions within the quality frameworks. And as we move into the future, and hopefully, past summer 2021, we will be hopefully starting to think about how we can use self-evaluation and provide tools around that on the other key questions within the quality frameworks. But that's, I suppose it's an invitation for services who have capacity, and of course we absolutely recognise the burden that services are under just now. So this is for the future, but the process is absolutely transferable to all the other key questions within the quality frameworks. We've simply picked out the key areas and looked at the quality illustrations within those frameworks, and then pulled out questions associated with those quality illustrations to suggest questionnaires for you guys. So you could undertake that process if it's something that you have capacity for, maybe now or moving into the future. So again, it's maybe just to highlight that again. I see another question's coming early, so I'll leave that for you. Actually, so I'll just read it out for you then. It's from somebody called Aidan. Great name, Aidan. Will some services not have an annual inspection as usual? Alison, maybe?
Yeah. Sorry, I was on mute, Aidan. I was
trying to answer. At the moment, we are still doing inspections based on risk. And that's how inspections will be planned going forward at the moment. That's as much as I can say currently. And that's what we do on a regular basis as inspectors, is look at the information coming in through the health through the health hubs that we sit with as well, in terms of their risk analysis, as well as our SAT risks for services, looking at complaints and notifications that are coming in, like adult support and protection, and we take all that into account before we make a decision, and that's what we are using to prioritise services that are currently being inspected, and that is going forward into the new year at this moment. So you're absolutely right, there probably will be services that will not get an inspection until 2021-22 potentially. Bear in mind that some services may get virtual inspections rather than actual people coming out to the services. So that's a potential to be used for low-risk services as a way going forward. But also our inspection activity is also impacted depending on the tiers that the Scottish Government are putting people into, and that also has an impact on how inspections can be carried out.
Brilliant, thanks, Alison. Okay, I think that's all the questions.
just one more coming in there, I think, Lisa.
Oh, here it is now, sorry. Okay, from Alison, how much collaboration have you had with HIS moving forward? Have they been involved in the development of this tool, especially with their future involvement in care homes? So, Aidan, do you want to take that one?
Sure. So, Alison, I think you're referring to the essentials of care that HIS are in the process of developing. So these are two separate pieces of work, but they do have synergy. So we've been heavily involved in the planning for the essentials of care work, which will be essentially, if it still is town, an area where you can access different tools and resources around key drivers such as communication, transitions, clinical and safe care. And within those kind of headline areas, there'll be tools to support services around communications, around transitions, such as staff handovers, communication tools, SBARs, etc. So that's being tested by HIS just now in health and social care, and we're partnering them with that. But in terms of this self-evaluation tool and guidance, this is a Care Inspectorate driven and led process. They're aware that this is happening and it's being communicated to the sector, and this is kind of nearly out with their remit in terms of supporting social care, because this is around our quality frameworks. But we are working in collaboration with all the national stakeholders and national organisations around supporting health and social care, and obviously our stake is primarily around social care, so that'll be around, you know, potentially learning from experience, potentially around the new infection prevention control manual for care homes. That will be around infection prevention control training and various other things that various national organisations are working on. So I suppose that was a long-winded answer, but they haven't been involved particularly in the development of this tool, but we are involved with their essentials of care work.
Great. Alison, you might want to take this next question. It's a comment and a question from Aidan. It says, totally understandable for lower risk services who do not get an inspection. Is there anything to consider, or just simple, for example, sending on improvement plan to the Care Inspectorate officer?
As far as I'm aware today, there's nothing being asked for or consideration about that. Obviously, people will have their annual returns to start completing in January up to February. That's the next thing I know you've been asked for, but being asked to produce anything to say no in terms of sending us in something to then kind of do a tick that, yeah, that's fine and we won't be inspecting that service. No, that there's nothing like that being discussed currently. At the moment, we're still working, as I said to you previously, just around risk, and that's the way currently we're going forward. That's not to say that won't change in the new year.
Fab, thanks very much, Alison. Okay, I think that's all the questions we've got, Aidan.
That's perfect. Thank you very much, everybody, for your questions and for the people posing the questions. If there's anything that does come up, next slide, please. Sorry. If there's anything that does come up, next slide, please. There's an email address here that you can contact us on, and we'll be happy to provide you with any more information around the tools and its use. I would also signpost you to your case holding inspector, who have all had training and awareness sessions around this tool and its use, so they should be well versed in order to talk you through how to use it and how you would like to communicate with them about it. I mean, if you do decide that you want to use this tool in its entirety and you have capacity to do that, that's great. Then you can then communicate that with your case holding inspector to make them aware that that's available for them to review. Again, this is not mandatory and you don't have to do any of that. It's really up to the individual services and how you communicate with your inspector. And also, again, there is the link there, which is now on the chat various times. There's one there that's direct to the documents on our website where you can find that. And we will send the slides, and this is being recorded today. it's only the speakers and things that we need to communicate about that recording with in terms of permissions, because none of you guys have been on talking. But we will more than likely make this available on the website, and we'll get those links out as well so people can review the conversation and use it as a tool to share with others. Just one last thing on the chat function, Stephen's popped in a feedback form on how you think this webinar went and whether you think it was informative and what your interpretation of the tool is. When Stephen sends the slides out, he'll also send that evaluation form out, or that feedback form, sorry, out there. So if you want to take some time and review the tool and digest that and then fill in that feedback form at that point, that's fine as well. So it just leaves me really to say a massive thank you for taking an hour and a half out of your very busy days, particularly in COVID, particularly leading up to Christmas and flu, to participate in this. There's been 150 people on this call today, so that's a massive turnout. So thank you. And to say a massive thank you to all the people within the Current Inspectorate who contributed, and to our guest speaker, Daniel, who has taken the time out to prepare and deliver his interpretation of the tool in his service. So it just leaves me to say Merry Christmas. Hope you have a very enjoyable and relaxing festive period if that's possible, and a very happy New Year. Thank you.